So,
With you?
He wants to confirm the patient's name,
Oh.
because the other 9 people, I guess that wasn't good enough.
okay, this is Julie Bach, and our date of birth is 3/4/65.
Right. And doctor, I have 2 MRIs entered here. One, it says knee and it's chronic anterior knee pain. There's another one also which says knee injury, but that one is entered for left hip. So I'm not sure which one. Do we need hip and knee? Is that what we're looking at?
Well, so she's seen an orthopedist, and he's convinced there's some problems with the knee. But during his exam, what really was outstanding was the pain she had in her hip. He's a knee specialist, so he basically ignored that. And when we look at her problems, it seems that she has a fairly substantial injury of the piriformis muscle, and that's what we're hoping to document and see her get better. So that's the whole purpose of these MRIs, is to understand better how best to treat her. She's really, I mean, she's.
Dr. Bach,
Mhm.
can I just because we didn't get any notes or anything. Can we start from the beginning? Is it post-traumatic injury?
Yes.
What's been happening with this patient?
She
Just so
got-
we have a little bit of context as what we are looking at here.
She's been struggling with the piriformis symptoms for quite a while, but she had a twist injury on a tennis court, and this was about
On the 18th of January.
on the 18th of January, and she's been really struggling since then. She's got a knee brace, she's using a cane. It's been really a nightmare.
And I had another fall last Saturday.
And doctor, the question, when she had the twisting injury, was the concern that there was a meniscal here? What was the concern?
My gut reaction is the orthopedist, I mean, she's got some tenderness consistent with a possible meniscal tear. The symptoms though, even during his exam, are just horrid in the area of the piriformis. So that's the whole concept of getting that checked. The knee may have an abnormality that is significant, but the piriformis seems to be the one to really address. So that's why we're kind of stuck
And
with.
that has been going on for before, right, doctor?
Since
Yes,
Injury, the symptoms
So
have
we're
been going on
We're
for
estimating the piriformis symptoms as being in duration since about November of last year. But they just got
Okay.
way off in a ditch after that fall. And she's been really, ever since then, she's just been living in
Any
horror.
x-rays, Dr. Bob, any x-rays?
Yep, 10 x-rays.
10 x-rays, yes. So the x-rays are showing no abnormalities. She's had a L5S1 surgery for a disc quite a while ago. So the MRI shows some joint space narrowing at that disc level, but there's no signs of sciatica on exam. There's no straight leg raise, there's nothing like that. It's primarily pain that she experiences, and then on palpation of the piriformis close to the insertion, it's kind of off the chart. So even though the orthopedist.
So she had this before, it just got re-aggravated.
Yes, it's gotten much worse. Yeah, it's gotten much worse.
She had it. Okay. And doctor, for this piriformis, has she had any treatment?
She's had one steroid injection with some partial benefit. She's been taking NSAIDs very regularly. She's been taking some cyclobenzaprine, anti-muscle spasm medicines with some benefit. But it seems like the whole thing has really gone in a ditch since this fall. So we're really trying to.
Okay, so do you suspect there could be another injury on top of what's happening after the fall?
Right, that's what we're
Was
thinking.
it a significant fall?
Yeah, it was kind of. She was playing in a court right next to me, and I I was playing, all of a sudden I heard this woman screaming, and I didn't recognize her voice, and I turned, and there she is laying on the floor, and she was, I have a couple of friends that are doctors, and one was like 911, and I was like, no. And we, she laid for a while, she got a little bit better, and then we kind of limped her out to the car. And she was getting better over about the first week, and then just had a failure walking, and fell again. And since then, this posterior buttock area has just been absolutely wicked. But the knee is also mildly abnormal too, so it's kind of hard to judge this combination of things. That's where it's coming across, is that we would address.
Doctor, can I, because I think the question would be where they would intervene, right? She seems to be failing, conservative measures. It seems like hip area or that area is a bigger issue right now since the fall. Does that make sense?
Well, I certainly would agree with you there.
Can we, because if she has had this performance syndrome and after this fall, this pain is much worse, her x-rays are unrevealing, and she certainly had this traumatic injury, and we're looking to see, what's causing this super, worsening pain. I can get the hip done, if that's okay, because that's probably where the pain is from. For the knee, if it's just, even if there's a meniscal injury, unless the orthopedic surgeon is requesting it pre-operatively for acute, they would just recommend doing some physical therapy and conservative management on the knee first.
Yeah, well,
sounds like that, she had significant trauma there, although she had some symptoms before, but it's way worse. Is that accurate?
Yeah, that's a great description, yeah.
So let's take the MRI of the.
So Dr. Bob, what I can do is I can, given what you're telling me about her injury, and given I think you mentioned that she's not able to walk, she has a brace and a cane and still significant pain after all the medication and unrevealing X's. I can get the hip done, and then maybe once you have the hip done, we don't have an answer to what her issue is. Maybe revisit the knee after some time. Will that work?
That sounds very appropriate.
Give me the code.
Okay, so let me just give you one quick second, Dr. Bob. I'm gonna, put in some details here because about our conversation, and hopefully I can get this hip authorized for now for this baby. And Dr. Bob, for the knee, should I just withdraw it for now? And you can re-enter it. You want me to put in a denial? How would you want?
You could call it a denial for now, and then we can always reevaluate that as time goes on.
Okay. All right. So just give me 1 second. And, all right. Just 1 quick second. I'm just finishing up a couple of things I need to enter here, and I should be able to get the hip done here. Almost there. You have to, put in documentation for both before it will give me the number for the hip. So, Dr. Buck, for the hip, the AUX number is 235
Yes.
864 526, and the validity starts today 1/31/2024, and it's good through 2/29/2024.
Well, I really appreciate your time. I think you're actually very appropriate to propose we just do one area at a time.
10 people.
Yeah, no, thank you. Yeah, we want to help the patients. It's just that we sometimes